We're at the 2019 CROI in Seattle. We're here with Matthew Freiberg from Vanderbilt University in Nashville, Tennessee, and we're really appreciative of you taking the time to speak with us on cardiovascular risk in HIV patients. So tell us about your
study
your study.
Yeah, so previous studies and presented here at CROI have demonstrated that HIV-infected people have an increased risk of heart attack, stroke, heart failure, but sudden cardiac death is an outcome that hasn't been very clear. And in fact, there's one major study done by a gentleman named Dr. Xian Zhang, who presented right after me today, has suggested that HIV-infected people had rates upwards of 4.5-fold higher than uninfected people for sudden cardiac death. It's rather substantial. So he and I actually had two different studies today. Mine was looking at 144,000 veterans in the Veterans Aging Cohort Study, trying to ask if HIV-infected people had an increased risk of sudden cardiac death. He had a smaller study that was looking at autopsy data within the city of San Francisco as well. Both studies, ours included, suggested there was an excess risk. In our case, HIV-infected people had a 15% excess risk, but for those who were not suppressed over long periods of time, that's where the risk was greatest. For those who maintained suppression we had a 10-year follow-up period in those people, we found the hazard ratio was almost 1. And that doesn't mean that people who are virally suppressed can't have sudden cardiac death. But we didn't see a risk that was higher than an uninfected person. Correct.
Yeah. So where do you go from here with this data?
Well, I think his study and my study provide two interesting things. One is trying to understand, if this process is real, what's causing it. His autopsy data today would suggest that fibrosis in the heart may play an important role. And that may have implications for heart failure, has implications potentially for sudden cardiac death, and more broadly, why is it there?
Is it inflammation? Or?
So fibrosis is the change of the muscle tissue, if you will, and you can see it when people have heart attacks. But what is interesting about this study is it may not all be driven by having had an atherosclerotic or a heart attack event. And if the HIV virus through inflammation may be changing that muscle, it may be helping explain why not only heart attacks, but why heart failure and even sudden cardiac death are a risk for these people.
But you have to figure that one out.
That one we have to figure out. We do not, we're speculating at best, correct.
But that's good to have that hypothesis to move forward with. No, it's exciting. So is that what you're doing now? Or
So I think our next steps are trying to figure out, well, there's a couple of things, but I think now that we think there's this risk, and if fibrosis is the mechanism, I think the next piece is why is it there, how does it get there, what's causing it? One of the questions that was asked today at the news conference was, do people need to be thinking about defibrillators to prevent from sudden cardiac death? And we're not nearly far enough to understand that, but it's a legitimate question. But I think that's where the state of the science is. I think the other thing that's important is, what we're learning in our study, and we've seen in other studies, when people lose their when their CD4 cell count goes down, that's half your immune system. Everybody's
CD8s or what?
Everybody's immune system wanes over time. One of the things that's interesting is that what we're learning in the HIV community may be very relevant for everybody. We're all aging. And the question is, what does it mean when your CD4 cell counts drop or your adaptive immune system changes with age? May give us insight into everybody's risk for heart failure, for heart attacks, for stroke. So the science we're trying to figure out here is more than, it's certainly to help HIV-infected people, but it has, I think, very important implications for people even if they don't have HIV, which is really exciting.
Or maybe other diseases
too.
Absolutely,
for sure.
Well, it's good to see this, look at it, but I know we have to have some inflammation, but we have excessive amounts in HIV. They call it now inflammaging.
Inflammaging, yes.
So it's getting to be quite interesting.
Yes.
So I appreciate very much you bringing this to us.
Absolutely, my pleasure.
I'm excited that we're getting the chance to interview you. And,
thank you.
And thank you for this work, because this is one that I'm dealing with myself.
Oh, so it's personal.
It's very personal.
I'm
very aware of the risks.
Great. Well, thanks for giving me the opportunity.
Thank you very much, Matt.
My pleasure.
Appreciate it.
Thank you.